Very good afternoon, everyone. Thanking God Almighty for His blessings on all of us. Uh, Respected Principal Dr. Purnima Ashok, our speaker for today, Dr. K. Deepti, my colleagues, all the registered delegates who include faculty, students, girls, boys, and girls and women is the key point today. I welcome you all this afternoon to this webinar on women's health care, being organized by the Women's Cell Committee of Acharya and BM College of Pharmacy in association with the Association of Pharmaceutical Teachers of India, a Women's Forum. And I'm happy that we have the consent of the speaker to deliver a lecture on the topic Girl or Woman, Health and Stigma. We as faculty members, we have students in the college, girls and women. It is not an exaggeration if I say that we are negligent about our health. So in this context, the Women's Cell Committee of ABMRCP wanted to have a webinar on the women's health care. And we have our speaker today, Dr. Deepti. I now request Mrs. Nagina to introduce the speaker to us. Nagina, over to you. The presentation hasn't loaded yet, Nagina.
Yes, good afternoon, everyone. I am Nagina Taj, Assistant Professor, Acharya and BM College of Pharmacy. It's my pleasure to introduce our today's speaker, Dr. Deepti K. Ma'am has completed MBBS from Guntur Medical College, Gunturu, in the year 2005. She has completed MD Biochemistry from Andhra Medical College, Visakhapatnam, 2016. She has started her career as teaching associate at Katuri Medical College, Gunturu. She worked as senior resident at King George Hospital, Visakhapatnam. Ma'am is currently a consultant and head Department of Biochemistry, Vijaya Diagnostic Center, Visakhapatnam. She is actively involved in teaching medical and paramedical undergraduates. She is performing daily internal quality controls and their interpretations, performing and maintenance of external quality assurance scheme from CMC, Vellore. Ma'am has participated in various regional CMEs at Andhra Medical College and Rangaraya Medical College. She has also participated in zonal CME at GSL Medical College, Rajahmundry. Ma'am has certified NABL training in internal audit and management systems as per ISO 15189 at Indus Hospital, Visakhapatnam, and also certified quality control training as per Six Sigma Matrix guidelines sponsored by CDC USA and Ministry of Health and Family Welfare India. Ma'am has participated in Dr. Pedavir Raju's Gold Medal Award for the best research paper in investigative medicine on the subject study of C-reactive protein and antioxidative potential in patients with chronic kidney disease in 2016. So with this brief introduction, I welcome you, ma'am. Over to you, Madhvi, ma'am.
Thank you, Nagina. Before we go to the scientific session, I request all the delegates who are registered to kindly be on the mute mode. You may keep your webcams off so that the speed was not disturbed. Do not go into the present now mode. Be watchful about that. Any queries may be addressed by posting your questions in the chat box and they'll be taken up after the scientific session. The feedback link will be shared in the chat box after the webinar. Thank you so much. Now I request my friend Deepti to present the session. Over to you, Deepti.
Hello, you can hear me clearly?
Yes, you're audible.
Okay.
Please upload the presentation.
Good afternoon,
Yes,
everybody.
slide is visible. Yes, thank you. Over to you.
This is Dr. Deepti from Vizag. I'm working as consultant biochemist and HOD biochemistry department in Vijaya Diagnostic Center. And I'm very happy today. Thank you for inviting me. I'm very thankful to the chief patron Shri B.M. Reddy and patrons Shri B. Premnath Reddy, Srimati Shalini Reddy, and Dr. Poonima Ashok, Principal of Acharya and B.M. Reddy College of Pharmacy, Bengaluru. Thank you, Dr. V.L.R. Madhavi. So, I will get into the topic today. Is it all right, Madhavi?
Yes, you can
Okay.
start with the presentation.
Yes, today's topic is girl, women, health, and stigma. So, as the name suggests, you can understand what we're going to discuss today. So, there is a declaration which started in the 1995 and it has finished its 25th year on the 8th of March 2020. It's called the 1995 Beijing Declaration and Platform for Action. It remains the world's most progressive blueprint for advancing gender equality worldwide. Actually, it's worth mentioning here at the beginning because an excerpt from the conference says that if there is one message that echoes forth from this conference, let it be that human rights are women's rights and women's rights are human rights once and for all. So the main points of this declaration was that sexual and reproductive health conditions remain one of the leading causes of mortality and morbidity for women and girls. Violence against women and girls is the most frequent human rights abuse worldwide. And one point worth mentioning is the WHO, World Health Organization, has classified the top 10 issues for women's health, namely cancer, reproductive health, maternal health, HIV, sexually transmitted infections, violence against women, mental health, non communicable diseases, being young, and even getting older is an issue, according to the WHO. So, today we are going to discuss about some health issues faced by our present scenario, women. That is, the first one is iron deficiency anemia. See, this is the most common nutritional deficiency in developing countries. I don't want to go into the depth of the classification, but you are well aware that there is a categorization between by the size of the RBCs into microcytic, macrocytic, and normocytic. So the iron deficiency anemia comes under the microcytic component. Well, important to know is the causes of iron deficiency. They are chronic blood loss, increased demand as in pregnancy, malabsorption of iron, inadequate iron intake, and there are conditions like sickle cell anemia or thalassemia, wherein there is breakdown of RBC, that is called intravascular hemolysis, or it could be a combination of any of the above factors. So I'm going to concentrate today on the chronic blood loss, that is heavy menstrual loss. These are stigmatic topics that people generally don't talk outside, but today I'm going to be free and talk to you about it. And there's this inadequate dietary intake component, as well there's worms in the gut that people generally don't take real good care of, so which leads to malabsorption and iron deficiency anemia in turn. So, since this is the most overlooked complaint, I would like to see you through the chief complaints. They are fatigue, lassitude, as in lack of energy, palpitations, wherein you can feel the heartbeat outside, and then there's generalized weakness. People overlook these things. And the clinical features are that they have pale conjunctiva, the eyes, you can see the eyes, the nails, and the skin beds, they're all pale, and they have brittle spoon-shaped nails, and the tongue is often shiny for these kind of patients. And there is pica also, that is compulsive eating of non-food items. So as you can see, this picture clearly demonstrates all the features. So there's something to be avoided. How do we avoid it? By actually taking enough quantity of iron, that is 20 mg. That is a daily allowance of given by ICMR, and only 1 to 2 mg is absorbed of the 20 mg that we consume. And children between 13 to 15 years, The requirement is 20 to 30 mg per day. For pregnant women, it is 40 mg per day. It's worth remembering. So the sources of iron, as you all know, it's good. It's worth remembering also again. Leafy vegetables, pulses, cereals, liver, meat, jaggery, cooking in iron utensils, and milk is a very poor source. That has to be remembered. Now next we'll go to another important topic called menorrhagia, which is heavy menstrual bleeding. So, the first and foremost reason for such heavy menstrual bleeding is hormone imbalance. Usually, in a normal menstrual cycle, there is actually a fine balance between the hormones estrogen and progesterone. But if there is some problem in that, the endometrium, that is the inner lining of the uterus, that develops in excess and it sheds off as bleeding. So, what are the conditions that cause this heavy bleeding? First is PCOS, that is polycystic ovary syndrome, obesity, insulin resistance, and thyroid problems. As you can see in this slide, if there's too much estrogen, you suffer from heavy periods, hot flashes, painful breasts, fibroids, and premenstrual moodiness, which I'll go further. If it's too little estrogen, you're fatigued, you have weight gain, hair loss, vaginal dryness, you're prone to chronic urinary tract infections. So equally important for bleeding dysfunction
Deepti? Hello? Hello? You're not audible. There's some interruption in the connection, I believe. Seems to be some network issue. Audience, regarding the inconvenience, please be online. There is some network issue at the end of the speaker. Please be on hold. Meanwhile, if you have any comments or any queries on this topic, you can leave your remarks in the chat box. Yeah, I think the speaker has logged in back.
Yes.
Upload the presentation, yeah, once again.
Yes. Till where did I, like, where was I
Es-
present?
Estrogens, that's where it got off.
Okay. Okay. Is this the slide?
No, estrogen.
Can you see?
Slide, slide 11.
Can you see the?
Yes. Yeah, please continue. S- Slide 11 on the previous slide. Slide number
This
10.
one?
Yes.
Okay, that's, yeah, fine. Yeah, you get it? Can you see it?
Yes, put it on the slideshow mode, please. Yeah, you can
Yes, I
proceed.
did.
Yeah. Please proceed.
Yeah. See, when there's too much estrogen, you should look out for heavy periods, hot flashes, painful breasts, fibroids, premenstrual moodiness. These are the components. If you have too little estrogen, you can look for fatigue as a warning sign, weight gain, hair loss, vaginal dryness, chronic UTIs. The next reason, or yeah, the next reason for heavy menstrual bleeding is dysfunction of the ovaries, wherein the ovary doesn't release the egg. So as such, you have hormonal imbalance and it may result in menorrhagia as well. So there's a condition called uterine fibroids. It is nothing to be alarmed about because these are non-cancerous tumors, and there have been many pregnant women do come with the fetus alongside a fibroid. You know, on scan they do recognize, and this is nothing to be worried about because they they are delivered. The baby is safe. You know, in many conditions it has happened, so there's nothing to be alarmed about, even if a fibroid has been diagnosed. So these also cause heavier menstrual bleeding. Next would be polyps. As you can see in the picture, these are small benign growths on the lining of the uterus. They also may cause heavy prolonged menstrual bleeding, but these are also treatable, nothing to worry. There's the condition called adenomyosis, a bit painful, wherein the glands from the endometrium, that is the inner lining of the uterus, they go into the uterine muscle. So there is internal bleeding sort of a thing going on, and external as well. So there's heavy bleeding and there's painful periods as well in this. Next would be the intrauterine device. Married women who go for certain contraceptive procedures, who opt for this IUD, they do land up in excess bleeding during period, which can be managed. If they meet the gynecologist, they can manage it very well. And then there are pregnancy complications wherein a single heavy late period, sometimes you just miss your period. Married women just miss their period, but it results in a heavy period. It could be a miscarriage. So nothing should be taken lightly. And then sometimes when they're pregnant, there could be a low-lying placenta, or placenta previa is the name for it. In such conditions also, they do land up in heavy bleeding during pregnancy, which can be managed as well. And the last one is cancer, wherein uterine cancer and cervical cancer also can cause excessive menstrual bleeding. Usually, women in the ages of 40s to 50s and more should be a bit vigilant on this part of on how their bleeding is changing every month. They have to have a look out on that. And yes, of course, there's these inherited bleeding disorders, clotting factor disorders like von Willebrand's disease. They also can cause abnormal menstrual bleeding. And there are certain medications like anticoagulants, as you know, warfarin or enoxaparin, or certain anti-inflammatory medications and hormonal medications also lead to prolonged menstrual bleeding. And certain other conditions like liver or kidney disease also can be associated with menorrhagia. So the final takeout from this is these cause anemia, and the pain also associated with these painful menstrual cramps, it's called dysmenorrhea. They have these both features as important ones. Now, after the blood loss thing and the iron deficiency anemia, dietary intake issues. Fads and fashion. In Times of India, it's given that unreal and airbrushed images of celebs and models is influencing many girls to land in body and image issues. Crash diets, they do crash diets for zero size. It may lead to hair loss, vitamin deficiency, weak bones, and other ailments as well. Many dietitians, many doctors, they say that, school kids are coming, being obsessed with their figures, looking at actresses and models, so that their Facebook gets more likes or WhatsApp gets more likes or whatever. This generation is going into that mode of getting likes. So this desire for diva like hair, skin, and body, coupled with peer pressure, it's pushing young girls to a condition called anorexia. So, see, as you can see, the girl is so thin, but then when she's looking into the mirror, she looks herself as a fat or a very overweight person. So, that is how their mind plays. A person who's properly in a condition called anorexia nervosa, it's an eating disorder which is characterized by an abnormally low body weight. They have an intense fear of gaining weight. They have a distorted perception of weight. They feel they are very overweight when they're actually very lean. So this is actually an emotional issue. Like things that have to be coped emotionally, they're trying to cope with food. They eat and they puke it out later, or they just avoid food. They wear more layers of clothing just to cover up their leanness. This is very common. It's more rampant nowadays. This girl is beautiful, but in Times of India, it's been given that for a skin issue, she's feeling sad. So skin is the worst affected area in this generation of youngsters between 20s and 30s because of the rise in the usage of steroid creams and preparations. In our daily practice, we see a lot of youngsters, girls coming with abuse of steroid creams. A steroid cream has to be applied very thinly as a very, very thin layer. But then but then they apply it they do not follow the instructions and apply it a bit more, and they land up with burnt skin. Have you ever seen a burnt skin? That is what these products are doing to youngsters. So we should be very careful if we are in that race to become fair. you know and there's these different ayurvedic allopathic chemical products also for skin and hair. They're being abused, and then you land up in hair fall and acne and all these sort of skin problems. So what is the key? Balanced diet and hygiene is the key to maintaining good hair and skin. So this is like a example of a diet chart for Indian women. And then the essential vitamins, all of these are essential: A, B6, B12, C, calcium, D3, E, folic acid, iron, magnesium, omega 3. All of these are important for women between 20 and 40. Folic acid and iron and calcium are even more important for women who are wanting to get pregnant or are pregnant. So, what is the take home from this slide? I am enough. When you look into the mirror, if you do not love yourself, why do you expect 100 other people to like you? So we need to love ourselves. If we cannot love ourselves and accept ourselves for who we are, we have these vain imaginations of being sufficient by doing certain things to our body, which is not required. So this is a very good take home for us, for all the girls. Problem is Adri, can you hear me? Am I on?
It's disturbing. Voice is getting disturbed.
Can you hear me now? Is it
Yes.
clear?
Yes. Can you try
Yes. The next
closing your cam? Maybe that would alter some speed. I'm not so sure.
okay, I can.
You can continue the presentation.
Okay, shall I switch off the cam? Okay. Yeah.
Please go into the slideshow mode.
Mm-hmm. Okay. Can you? Yeah, is it visible?
Yes. Huh.
Okay. Is it visible now?
It's not in the slideshow. Now it is in the slideshow. Yeah. Please continue.
Okay. The next complaint is amenorrhea, and we are dealing with secondary amenorrhea. We won't touch the primary amenorrhea, but it's worth noting because it is amenorrhea is absence of menstruation for 6 months or more in a woman in whom normal menstruation, that is, you got your period, and after a few months or years or whatever, you suddenly stopped having a period, and it's for 6 months. So there are several causes, as you can see in the slide, and I will not be touching those, but only the most common causes of secondary amenorrhea. So the first one is stress, exam stress, relationship stress, family stress, name it, any stress. It can cause this condition. You will not be having your period. Post pill. Some people go for emergency contraceptions and all of that. Excessive usage of these also can tip off the balance between estrogen and progesterone and lead to, you know, variations in your cycle. Sudden change in weight, too much loss or too much gain is also not so not so good for the body. The next one is PCOS, polycystic ovarian syndrome, or premature ovarian failure. Any of these can also cause an abnormal period. And then there's malnutrition as well. If you don't eat properly, also, you may not get your period on time. And if you do land in hypothyroid state, wherein your T3, T4 hormones are less produced by the thyroid, or in diabetes also, you may land in this secondary amenorrhea. Let's go to polycystic ovarian syndrome. This is manifested by amenorrhea, that is no periods, hirsutism, that is there's facial hair, there's obesity, okay, and then there's enlarged polycystic ovaries. For they have excess androgens in their body, and there is some diagnostic criteria for it worth mentioning, that their ovaries do not release the eggs first thing, and then they have hyperandrogenism, that is excess of male hormones are produced, and then there is polycystic ovaries. So what do the patient complain of? The patient complains of weight gain. So that is something, you're in your 20s or in your teenage and you start increasing weight just like that, then you have to watch out for PCOS in the future. Like, you have to really monitor your weight and look for other things. As you can see here in the slide, facial hair. If you're having to go to the parlor repeatedly to get your eyebrows or face hair waxed and all of those things, just be on the watch out for it. If you have excess pimples or acne, as in, like, it's normal to have acne, there's nothing wrong, like it's nothing abnormal, but then you can see that in PCOS there is excess. It doesn't like through the month, it doesn't come down, and there's irregular periods and weight gain. As you can see, in the future it might land in infertility. So in this slide you can see there is a condition called acanthosis nigricans. It is very much suggestive of PCOS because there is darkening, hypopigmented thick skin on the nape of the neck, in the groin, in the axilla and other areas. So you have to watch out for PCOS for in later life. See, acanthosis nigricans is a specific skin change due to insulin resistance. And obesity is also recognized as an important contributory factor. It also leads to insulin resistance, which I'll go in the further slides. The next taboo topic is abnormal vaginal discharge. So, how does a normal vaginal fluid actually look like? It's watery, it's white in color, it's non-odorous with pH around 4.0. So, if there is any abnormal vaginal discharge, as in you have to look for changes in color or consistency or amount, you should see for presence of blood outside of your period, you should see for itching or discomfort or a rash, and then you should observe if there's any foul odor. What is the color of the discharge? Is it yellowish or greenish or grayish? So, or during urination, you have some burning in the vaginal area. So you have to look out for this. These are all abnormal components. There is also a normal component wherein the vaginal discharge is more, it's excess. But then it is normal. That is called leukorrhea. Leukorrhea is a taboo subject for many people. Many women who come to the gynecologist are not able to freely tell them that they are having this. Okay, only on examination, the gynecologist knows that they are suffering from this kind of an issue. So we need to know about it a bit in detail because the excessive secretion that is coming, which is normal, it is either due to a physiologic excess that happens during puberty, it happens during the menstrual cycle, during pregnancy also, and during sexual excitement also, it is normal. And there are cervical causes as well, cervical ectopy, chronic cervicitis, mucus polyp. There are other several things that you need not go into depth. Vaginal causes also. Uterine prolapse also causes excessive secretion. Acquired retroverted uterus, and then chronic pelvic inflammation. Using pills, contraceptive pills, of course, you may land in excess but a normal vaginal secretion. The next taboo topic is pruritus vulvae, wherein there is a sense of itching. Pruritus is itching. When it is confined to the vulva, it is called pruritus vulvae. It should not be confused with pain. Hello? You there, Madhvi?
Yes, Deepti, you're audible. Please continue.
Yes, yes. So the pruritus vulvae could be due to causes like vaginal discharge. If there is a vaginal discharge due to Trichomonas vaginalis or Candida albicans, you may land up in a pruritus vulva. And then local skin lesions like psoriasis or seborrheic dermatitis or fungal candidal infections lesions, all of these also cause excess discharge and sense of itching as well. Viral causes are herpes genitalis and genital warts. And parasitic. It happens usually in school children that they wake up in the middle of the night complaining of itching. So when you really light a torch and see, you can see thread worms there. So a tape test is done to really assess if it is thread worms or not. Even infections like scabies or pediculosis also cause sense of itching in the vulval area. And there are sexually transmitted diseases like gonorrhea or trichomoniasis. Gonorrhea is not common these days, anyways. So they also lead to itching. There is also a component called allergic or contact dermatitis, wherein using nylon undergarments, what you see in magazines and all, they're just for show. Please don't use it because they cause all these kinds of problems. Even using certain soaps or detergents also causes these kinds of things. And condom related allergies are also present for certain women, and they present with this pruritus vulvae, which is actually all of these are treatable, nothing to worry. But you need to be open about it and talk to your gynecologist always. The treatment is nothing, appropriate local hygiene and using loose fitting undergarments, preferably made of cotton to keep it aerated. And the next taboo topic is human papilloma virus. People really don't know about this, but HPV is a group of viruses that are extremely common worldwide. It is mainly transmitted through sexual contact, and most people are infected with HPV shortly after the onset of sexual activity. Type 16 and 18 of HPV cause 70% of cervical cancers and precancerous cervical lesions. Okay, having multiple sexual partners is one of the risk factors of HPV, which is a major cause of cervical cancer. Once a person is infected by the virus, it takes 15 to 20 years for the cervical cancer to develop in women who have normal immune systems. If their immune system has fallen down due to HIV or certain infections like that, it progresses very quickly into cervical cancer. So please be on the lookout because barrier contraception is a must. As you can see in this slide, girls 9 to 14 can be vaccinated with this HPV vaccination. 30 years or older, they only can go for screening tests. Okay. For 9 to 14 years, sex education is a must and condom promotion and contraceptive usage education is a must for girls before they enter into their 20s. As you can see, these are the methods of contraception. Temporary or barrier methods, as in using condoms, natural contraception also by your calendar method, intrauterine contraceptive devices, steroidal contraception as well. In permanent, we have tubectomy and vasectomy. The reason I raise this topic is most of the gynecologists or surgeons or in government practice, we encounter a lot of girls landing up in pregnancies, unwanted pregnancies, and they take over the counter preparations. Okay, it's okay if the pregnancy is within the uterus, but there are conditions wherein ectopic pregnancy happens. And if you do take a abortifacient drug when the pregnancy is not within the uterus but somewhere in the fallopian tube or some other location, the pregnancy is going to get terminated and there's going to be a lot of blood loss and it is a major emergency. The baby, the child, I don't say child because of course yeah, youngsters only do these kinds of things. So because they don't know. So they land in shock, they land in emergency and for doctors also it's very difficult to handle such cases because we may lose the life. Okay, so there is a lot of abuse going on with the contraceptive methods. People are not aware. So girls of this generation need to make themselves aware of all of this before doing anything further. So women should start pap smear screening at the age of 21. Between the ages 21 to 29, women whose pap smears are normal only need to get it repeated every 3 years. Women over 30 should get HPV tested through pap smear test every year. So this is the menstrual hygiene management. I'm skipping quick because we've lost some time. So menstrual hygiene management is very much important. Use of sanitary pads and frequent change of pads. That is 4 to 6 hours. You shouldn't use the same pad after 6 hours because you may land up in other problems like toxic shock syndrome or there are several other. There's a big spectrum of problems you may land. So please make sure to be very use it for a short duration and then appropriate disposal techniques. And if there is any problem, feel free to talk to your elders or the most trusted elders or friends because it helps a lot with menstrual problems. The next disorder that we have to talk is thyroid disorders. If you are landing in a hypothyroid state, look out for hair loss, fatigue, sensitivity to cold, constipation, increased cholesterol, weight gain, dry skin. Dry skin is something we can catch very quickly. Hair loss is something we can catch very quickly. A small thyroid profile checkup doesn't take much. So we can always go to the physician and get us checked. And then there is hyperthyroid. That is, they are slim. They are very lean. They have fine brittle hair. They have trouble sleeping. They have excessive sweating, weight loss, high blood pressure. They're anxious most of the time. They have moist skin as well. So you can differentiate and demarcate easily by educating yourself on these topics. And then there is insulin resistance, which is a whole plethora of, it's like a Pandora's box. It opens our life to so many diseases like type 2 diabetes, PCOS, atherosclerosis, dyslipidemia, hypertension, and all of that. What happens is here in this diagram, you can see a cell, right? And there is insulin, the hormone insulin standing outside the cell. Now, as and when you eat a bag of chips or you eat some rice or whatever, glucose, it breaks down into glucose, right? The carbohydrate. And that glucose goes to the cell. The molecule goes to the cell and knocks the cell door. And then this insulin comes. What does it do? It knocks the door for glucose and says, cell, open the door. And when the cell opens the door, glucose enters in. In insulin resistance, what happens is when there is a lot of obesity going on, a lot of weight gain going on, the insulin cannot relate to the cell. The cell says, no, I don't know you. So the insulin cannot open the door for glucose. As such, glucose stays back in the blood and then sugar levels keep shooting up. Now what will happen to the excess sugar in the blood? It goes to the eyes. Okay. It goes to the kidneys. It goes to the major organs, peripheral nerves, and it affects on various levels, landing in a condition called diabetes mellitus. So insulin resistance is a very scary thing. Weight Yeah, you can see the symptoms of insulin resistance. There's a craving for sweet and salty foods. They're very tired most of the time, and they have a frequent desire to go to the urination. And then there's darkening of skin, like the acanthosis nigricans, which I said it's also seen in insulin resistance. There's increased hunger or thirst. There's tingling sensations in the hands or feet. You can see here, this left side, the lean lady, she's okay with that little food. But if you're going into insulin resistance, the more you eat, you're never satisfied. You have to eat more and more as your weight gains, because the glucose is not going inside the cells, it is staying in the blood itself. So this is actually, as you should be careful when we are landing in this stage. We have to be monitoring our weight always. Next problem, which is usually comes into the 40-50 age group. If we don't have our calcium, vitamin D adequately in the 20s, we are sure to land up in a condition called osteoporosis. That is density diminishing, bone becoming porous. The more porous they become, the more fragile, and then they are susceptible to fractures. As you can see in this slide, see, there's a loss of height over time, and there's all fractures going on. Women are likely to get osteoporosis more than men, and the age is like elderly aged over 45 are at risk for this disease. Having a small body frame is considered as a risk factor for porous bones as well. So, what are the foods that you have to have? Calcium rich foods, just supplements. You can take tablets, vitamin D, the sun, exercise, taking lots of milk and cheese products, all of these, they prevent osteoporosis. Next is diabetes. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. So, what are the symptoms you need to look out for? Frequent urination, desire to drink more and more, inexplicable weight loss, if you're eating too much, skin infections, extreme fatigue, high blood pressure, vision related problems, reduced sensation in feet and hands, non responsive wounds. So, this component can also come into pregnancy. It is called gestational diabetes mellitus. Okay, that is, they have diabetes in pregnancy. So about 50% of women with gestational diabetes go on to develop type 2 diabetes. So you have to have regular antenatal checkups. You have to have a tie-up with a gynecologist who orders a glucose test for you, a glucose tolerance test for you in your 7th month of pregnancy. It is a must. Next condition is breast cancer. You can see if a person has a constant breast or nipple pain, or if the nipple is inverted, look out for a rash or color on skin around the nipple, or a change in the size and shape of the breast. You can see if there's dimpling or change in the texture of skin, or a lump, or a thickening in the breast or underarm, or if the whole breast area is swollen, or if there is unusual discharge from the nipple, you have to watch out. Please meet your surgeon. A female surgeon would do a good job at diagnosing much earlier. How do you reduce your chance of breast cancer risk? By limiting alcohol, by not smoking. Of course, in our country, it's not common, but yeah, there are youngsters going for smoke as well. Girls, it's not required. Smoking is not required. Control your weight, be physically active, breastfeed, and limit your dose and duration of hormone therapy. Avoid exposure to radiation and environmental pollution. So, what is the test that you have to go for? It's a called mammogram. Women of the age 40 to 44, they should have the choice to start the annual breast cancer screening. 45 to 54, they should get mammograms every year. 55 and older should go for mammograms every 2 years, or you can go for yearly screening as well, just to prevent breast cancer. Now, lastly, depression, feeling depressed. You can see in this diagram, it shows if you have any low self-esteem issues, and if you are losing interest in pleasurable activities, always resort to help, never delay. In the first instance itself, resort to help. because 1 in 8 women experience depression in their lifetime, twice the rate as men. So how do we come across, how do we combat all these diseases? Because since you are all very young, there's this emotional, physical, intellectual, spiritual, occupational, and social components. Emotional, you have to manage your emotions. Have positive attitude. You have to love yourself. Look at yourself in the mirror daily and say that you are good and you're beautiful. And then you are enough. Physically, you have to do all these, exercise and all these, good diet choices. And when you're working also, you have to make, or you're studying, you have to make goals. You have to set milestones and you have to test yourself always. So there are all these components that have to be looked about. So the key factors for wellness finally are optimum nutrition, eat properly, on time, balanced hormonal level. If you eat properly, exercise properly, everything will be in balance. Vitamin, mineral supplements. Since our foods are a bit contaminated nowadays, always have supplements. Adequate intake of water is a must, which we forget in our day-to-day routine. And there's exercise or meditation, and deep relaxation is a must these days. You can say no to your mobiles for a while, set aside a time to say no to mobiles, and then go for adequate sleep and relaxation. Finally, it's calming your mind. It is very important. So, take home points, feel free to speak to a gynecologist or a physician or whichever doctor reachable to you. Please feel free to speak to them. Please maintain a close friend circle, because you need to be accountable to somebody and you need to look up to somebody when you're in a problem. When there are stigmatic issues involved, sharing is always a must to avoid problems. Always think twice before doing anything. So please take care of your body now. That is a take home point. Thank you. If you have any doubts,
Dr. Deepti, thank you so much.
yes, yes, yes.
You can, I think, minimize my presentation now.
Sure, sure. Yes, I
So,
have.
um, uh, we have very few. I think the most of the registered audience haven't come, but those who are attending to the webinar, any queries and all, you may please put it in the chat box. It's a bit disappointing, rather, that not much of the student community are here. This is actually intended for them. So, I think, Dr. Deepti, we have women faculty here. Would you want to say anything to them, rather? Because, as I'm mentioning you, that student number is less in the participants.
Yes,
Thank you
yes.
so much, ma'am. Yeah, this is Shilpa. Yeah, learned a
Hello.
lot of
Yeah, Shilpa.
points. Yes, learned lot of points. Thank you very much.
You're welcome. Yes, you're welcome.
Any of
Well,
the delegates you would like to ask anything or express something? Yeah, Dr. Deepti. So, any advice for the, like, they're all in our college, like our staff. So, I think they're from ages 25 and over.
yes, yes. I think
Any specific suggestions that you would like to give?
uh, yeah, the first and foremost as women, I think, would be giving time for yourself, which is quite tough because of family and other, children and all of these components. But I think it's worthwhile in today's generation to, set aside a time for ourselves to calm our mind and to relax first thing, and then to do something else other than what we do routinely, like working. Developing a creative hobby or something like that, actually it takes a lot of stress off of our plates. And the next thing would be the paramount thing would be exercise is all we can ask for in this generation, because all the problems that I have elucidated till now were all metabolic component, wherein PCOS is a metabolic component. Diabetes, thyroid, these are all having a lot of like what we reap we sow, they say, right? So if we don't exercise, we land in these things. So exercise, it's a lesson for me as well, because concentrating on exercise and taking food on time, proper food, proper food on time, and saying no to mobiles is a big thing for our generation as well. So maybe we can cut off mobile time, and then going for checkups. People are really scared to meet doctors or get some diagnostics done frequently, but because of the advancement in medicine, I think it would be great if people really shed that inhibition and went forward with the test. It doesn't matter, for that minute you may feel afraid, but then getting it diagnosed quickly actually helps us to cure it, because we have treatments for most of the things. Even for cancer, there's nothing to be afraid of. If it's in the initial, if we catch them initially, we can get it treated, and our lifespan is almost like not, it's not affected as much by even these crazy diseases that are out there. So I think, yeah, that sums up.
Yes, thank you. So we have two questions from our friends here. What is the frequency with which we need to see a gynec? From Sai
Hmm.
Vinila.
Yes, yes. As I've said, for pap smear, like after 30, it's better to go every year and get a pap smear done. And just to avoid this, uh, cervical, not to land in something like that. Pap smear is a must. And yeah, even for breast examination, also, it should be frequent. Best done by a surgeon or a gynec, you know. If you're 40, 45, you may as well go for a regular, whenever, like, it's up to your ease and convenience.
Yes, and we have one more question from Smile here. Does wearing
Yes.
body hugging or tight fitting clothes affect the health in any way?
Yes, of course, of course, it has to be breathable, whatever you wear, it has to be breathable. But since we have discussed about the gynecologic component of it, it really affects the flora there. You know, there is anaerobic environment. You're creating an, already it is an anaerobic environment. You are making it even more anaerobic by wearing tight clothing. And there is this chance of candidal infections and other infections as well. So better to avoid, or if you can't, if that is the lifestyle that we are having, better to use breathable fabric always, or change clothing frequently.
Yeah, thank you for that.
Yeah.
Any other queries from any of the audience who are here? So that was one thing. And would you like to add if there are any apps available, like, for reminders for women, if we enroll that, like how the vaccination reminders are coming now for kids.
Yes.
So are there any apps for women also where we might, have a follow up on our health issues? And like now we are with the working with the diagnostic center. So do they
Yes.
conduct this kind of annual checkups, as a package? What are essential
Yes.
for women of different groups, age groups?
Yes. Yes. Age wise, as I can speak for Vijaya Diagnostic Center. So because I work here, age wise we have different packages, and yes, there are apps as well, which I can, I can let you know later. I can forward you some links. Yes, of course, there are different, customized packages as well. All over the country, all over the diagnostics labs, there are. You can avail of the services.
So, and is it like, they can, we can tie up with any of the firms and will they be reminding us and coming us that because see, the
Yes, of
major
course. Yes,
negligence
yes, you
is
can
not
get
much bad.
registered.
Hmm.
You
Major
can get
negligence is not
registered.
bad is that we don't take the motivation to go or make the time to go. In
Yes,
personal opinion, of course.
yes, yes. I
So,
think if you're,
yeah, please, please.
yeah, yeah, I think if you're somewhere on the 40 benchmark, it's high time that you make it a point. You yourself motivate yourself to make it a point to get your weight, BP checked, your blood pressure, your vitals, your other vitals checked, and your thyroid and your lipid profile. Please, you have to concentrate on your lipid profile. Your cholesterol and triglyceride levels are a must. And you can just get them done. You really don't need anybody to suggest, your fasting blood sugar and your HbA1c. If you can just get them every 3 months or every 6 months, it would be great. Screening tests.
Okay.
Okay. Yeah. Checking
And
your weight.
would you
Yeah.
recommend any of these ultrasound scans for the lower abdomen and the pelvic region? Would that
If there
help?
is an issue, if you are persistently having some pain or discomfort, it's always better to go for ultrasound, of course, after your doctor's advice, of course. But you shouldn't be afraid to get any diagnostics done, because previously people used to be like that, but now the whole you know branch of medicine is changing. The earlier we diagnose, the better. And it shouldn't be considered as a big problem, you know just like you have a bike or a car, it needs servicing. And
Servicing.
for our generation, our body is not like our old generation, grandparents and parents. So because the food that we eat is not up to par, or the sleep our sleep quality is not at par, and neither is corona helping us in any of this situation with homeschooling around. So I think the stress levels are skyrocketing. So for us, we should consider our bodies as a mechanical device and get it serviced every once in a while.
Regular intervals.
Yes,
Yeah. Thank you so much. And I think if
yes,
there's any queries, we'll get you personally.
sure.
With this, we'll be closing the webinar for today. And I now request Dr. Ambajakshi to propose the vote of thanks. Ambajakshi, ma'am, over to you. Dr. Deepti, please, I think you can stop presenting.
Okay.
Thank you, Dr. Malvi. Good afternoon to one and all. I deem it a great honor and privilege to propose vote of thanks on behalf of Women's Committee of Acharya and BM Reddy College of Pharmacy. At the outset, let me thank our distinguished speaker, Dr. Deepti Konala, for making excellent presentation on women healthcare and stigma and making this webinar a very meaningful and interesting. I'd like to express my gratitude to the management for rendering us all possible support towards organizing this webinar. I wish to express my thanks to our beloved principal, Dr. Purnima Ashok, who has been guiding spirit behind all initiative, including this one. I would also like to thank Vice Principal Dr. Manjunath PM for his support and encouragement. I sincerely thank Dr. Madhvi BLR, moderator, for a valuable contribution and untiring efforts to make this webinar a stunning success. I mention heartfelt gratitude to the technical coordinators, Mrs. Nagina Taj and Ms. Payal Pramanik, who have been made this webinar a grand success. A big thanks to my dear colleagues, students, and participants. You have really made this gathering purposeful. Thanking you, one and all. Thank you.
Thank you so much, Ambajakshi, ma'am.
Thank you.
For all the registered delegates, the feedback form link is shared in the chat box. You may kindly fill it up and you'll be provided the certificates, e-certificates in 3 or 4 working days. So once again, I take pleasure in thanking my friend, Dr. Deepti, for making time for this webinar. Thank you so much.
My,
And all of you may please log out.
yeah, my pleasure, Madhuri. Bye.